Mpox has been declared an emergency by the WHO after a serious outbreak in Africa. How worried should we be? I'm Shani Wim and this is infectious diseases expert Dr. Su Li Yang, and today we're answering your questions about Mpox. What is Mpox? Doctor, what is it?
Mpox is a disease caused by the Mpox virus, which belongs to a large family of pox viruses that also includes members such as smallpox.
And what's the difference between the clade 1 and the clade 2 strain?
These are like virus variants, kind of like when we think of COVID-19 variants, for instance. So the clade 1 virus originated from Central Africa, while the clade 2 virus originated from West Africa. The disease for both is similar, except that for the clade 1 virus, there is a higher risk of serious illness and death.
How is Mpox transmitted? How contagious is it, doctor?
In the past, Mpox was passed mainly from small rodents to humans, and that's what we call a zoonotic transmission. In the most recent outbreaks, Mpox has been spread between humans by close contact. That means people who are, like for instance, when we're talking to each other, there is a very small chance that the virus can transmit between us. In the outbreak in 2022, and currently as well, sexual transmission has featured very predominantly. Somehow the virus has changed such that initially clade 2 spread more easily amongst humans, and now it seems clade 1 has also changed or evolved to do the same.
How dangerous is Mpox, doctor?
Mpox has a chance of causing death or disability, with clade 1 having the higher risk at close to 3% in Africa as compared to the clade 2 virus, which has a less than 1% risk of someone dying from it.
Who is most at risk if they contract the virus?
From what we know currently, those with compromised immune systems, and in Africa that's mainly those with the human immunodeficiency virus or HIV infection, are at a higher risk of poor outcomes. Of course, we also think that the elderly and very young children would similarly be at risk of a worse outcome if they are infected with Mpox.
And what are the symptoms, doctor?
So most people present with an initial flu-like illness. They'll have fever, body aches, maybe cough and respiratory tract symptoms, and then a few days later, they'll start developing the pox or the boils on their body. And this actually looks like a worse version of chickenpox. So I think we are most familiar with chickenpox, where there are crops or lesions or boils on the body. And the Mpox boil is usually about 5 or 10 times the size of a chickenpox boil.
Is it itchy? Does it hurt? Is it painful?
Yes, it is itchy and it is painful as well. And this will last for usually about 2 to 4 weeks before it all fades away.
Okay, and after it fades, will it leave a permanent scar?
Just like with chickenpox, there is a risk that there would be a scar that's left behind, but most people heal and then the marks fade over time.
And like chickenpox, does the virus also stay in the body? Like, does it lie dormant in the body?
I know the name sounds similar because they all end with pox, but the chickenpox is from a very different family of viruses compared to the Mpox virus. So the Mpox virus doesn't stay in the body long term, unlike the chickenpox virus.
Is there a blood test to determine Mpox? Are there any swab tests we can do at home?
Yes, there are blood tests and swab tests, but the swab tests can't be done at home because we don't have one of those kits like for COVID-19 when you swab your nose and then you run the test yourself. So currently Mpox is confirmed via a test that detects the DNA of the virus. And that can only be done in the microbiology laboratories in Singapore, including our National Public Health Laboratory.
So if I were to feel ill and suspect that I have Mpox, what should I do? Where should I go?
The first thing is to go and see a doctor. I think most of us have never seen Mpox in our lives, and so going to a doctor to confirm it would be best. And then the doctor, whether it's the polyclinic doctor or GP, can best direct a person to maybe the National Center for Infectious Diseases if they feel that the individual most likely has Mpox.
What are the incubation periods and post-recovery periods for Mpox? In essence, how long should we self-quarantine?
The incubation period is about 2 weeks before the symptoms first appear. As for how long it takes to recover, generally it takes for up to a month. I think in Singapore, someone with Mpox would be kept in a hospital, isolated until all the boils have disappeared before they're allowed to go home. But I did mention that Mpox can be sexually transmitted, and the current advice is to abstain from sexual intercourse for about 2 months after recovery, because the virus can be found in the semen of men who have recovered from Mpox up to more than a month after they have recovered.
How is Mpox typically treated?
Currently, we don't actually have a drug for Mpox. There are different medications that have been used. More recently, one of the more promising ones, which is tecovirimat, has been shown to be not effective in preventing death from Mpox in a clinical trial in Africa. So currently, most of the time, we would treat a patient symptomatically and they would recover on their own.
And how widely available is this medication?
Tecovirimat is available in Singapore, but not all doctors are able to prescribe it. Generally, one can get it at the National Center for Infectious Diseases.
Are there vaccines for Mpox, and are children vaccinated against it?
Yes, there are 2 vaccines that are licensed for Mpox. These were originally designed for smallpox, but because they are very closely related viruses, vaccination against smallpox also protects one against Mpox. These vaccines are present in Singapore, but they are not easily accessed by everyone. They are not on the childhood immunization schedule, nor are they on the adult immunization schedule. Currently, there is no need for these vaccinations to be on the immunization schedule because cases of Mpox are very rare in Singapore.
How can we protect ourselves from Mpox, doctor? What should we do?
Mpox spreads by close contact, so the main thing is to avoid an individual with Mpox or someone who has got multiple boils and you're unsure what they are.
Will it spread like COVID? Is it as infectious as COVID? Are we possibly looking at another lockdown?
Fortunately, Mpox is not going to spread as readily as COVID. COVID spreads in the forms of droplets and aerosols, and that is many times more transmissible than Mpox.
Is it safe to travel to Cape Town now? Is it safe?
WHO has not recommended against traveling to any African country, and it is certainly safe to travel to Cape Town.
Has it reached our shores? And given Singapore is a travel hub, are we at risk of a possible outbreak?
So we have had Mpox cases in Singapore, just dozens each year, and these have all been of the clade 2 Mpox, the less deadly variants. I think as the clade 1 variant spreads out of Africa, then the risk will increase since, after all, we are a travel hub to many countries around the world.
What is the government doing in preparation for Mpox reaching our shores? I think what this person is asking is our healthcare system ready to manage the disease?
The Ministry of Health has been giving regular press updates. They are obviously surveying the countries and to make sure to be aware, up to date, where the cases are. Doctors and the healthcare system have also been informed to look out for cases of Mpox. And because we don't expect a big outbreak in Singapore, our healthcare system certainly is not going to be challenged by this current outbreak.
That's all we have for this episode on Mpox. If you enjoyed it, let us know, leave us a comment and subscribe, and we'll see you in the next episode.